in a Whiplash program, it could be used in a professional setting, or it could also be done at home. We're utilizing two products. We have a product for the thoracic region, and we also have a product for the cervical, the neck region. Whiplash injuries are controversial and confusing. The main reason is because the injury doesn't present itself often until after the injury, and that has a lot to do with during the whiplash injury. Of course, we know the head moves, and it goes beyond the origin insertion of muscles, ligaments, and tendons, whether it goes back and then it will continue forward. The patients often feel fine for a period of time, depending on the severity of the injury. During the accident, we've got a stretch of the sternocleidomastoids. That's the largest muscles that run up and down the cervical region and control a lot of motion, whether it be rotation, okay, or flexion, when they both contract simultaneously. All right, so what happens is these muscles are sore. So a lot of patients will carry them shorter to relieve pain. So they will actually drop their head slightly forward, and they'll cradle just like so, all right? And then these muscles are shorter now, so there's less pain. Well, they get in the habit of carrying it there. What happens is the head's like a bowling ball. It weighs about 10, 12 pounds. So when the head is forward, like so, we have to carry that forward. So we have to adjust our bodies. What happens is patients have to look forward. We all have to look forward, horizontal, to see and function, to survive. So when we tilt like so, you're putting your C1 and C2 on hypertonic. That's the muscles that cradle the occipital region right below the occipital bone. They're on tight tension. They're working all the time. That's a lot of times causes headaches. So when they're always constantly contracted, we get a lot of stress into the cervical region. Not only that muscle, but once the head is slightly forward, there's a muscle here that's connected. It's called the levator scapula, and that muscle is the origin right about there that becomes very tender as well. That's because it's also hypertonic. It's always contracted. When the head is forward, these muscles are contracted. Also, now we have more of the upper tract. That muscle comes in to help also with the levator scapula to help stabilize, and that muscle sometimes becomes very hypertonic. So now the head is forward. We got lots of tension up in this region. The shoulders round forward. When that occurs, the middle lower tract, that's the muscles in between the scapula. These muscles become long. When muscles become long, they become weak. The muscles that are short become hypertonic. They also become weak, but they become hypertonic and sensitive. But the other muscles also become sensitive, but they elongate. So now we have lots of imbalances occurring. So we got to get in, we got to stretch the pecs up front, and we have to get in, and we have to go ahead and stretch the upper traps, levators, and we got to take care of all these imbalances. And that's what we want to do with the Whiplash protocol.